Okay, what I'd like to discuss in this short video is inflammation. And to discuss inflammation, we have to talk about arachidonic acid. We have to talk about prostaglandins a little bit. So, generally speaking, we have a cell membrane, we have a phospholipid bilayer, and we have an enzyme. Remember, anything that ends in ACE is an enzyme. So we have phospholipase A2. And this phospholipase A2 is going to act on arachidonic acid. And arachidonic acid can take two different pathways here. We could take a prostaglandin pathway, moving this way, or we can take a leukotriene pathway going this way. And it really depends on the enzymes. So we have a LOX pathway and a COX pathway, like oxygenase or cyclogenase. These are the two different enzymes. When we move in this direction, down this branch, the body can produce prostaglandins, thromboxanes, and prostacyclins, which we need. It has a variety of functions because we do need inflammation, right? I mean, inflammation is the first sign of healing. It's not always bad. Chronic inflammation is bad. Acute inflammation is good. So when you sprain an ankle, it should become inflamed. When you have an infection, you want inflammation. These are all essential to help the body rebuild, repair, and heal. So when these are activated, you have inflammation, pain. These are also, especially the prostaglandins, gastroprotective, meaning it can protect the gastrointestinal tract because prostaglandins are involved with producing mucus that lines the inside of the stomach. If you think back to the stomach, we have lots of acids in the stomach. Hydrochloric acid, pH is around 2.3. So the question you should ask yourself is, how does the stomach, with all these acids, how does it not digest itself? It doesn't digest itself, right? The stomach is protein. It doesn't digest itself because of the mucus lining, which is produced by prostaglandins. Now, if you block the prostaglandins and you can't produce the mucus protective lining of the stomach, and you have the hydrochloric acid naturally in that environment, now you start to erode the stomach lining away, and that's called an ulcer or a gastric ulcer. And that's what happens when people block this pathway with aspirin or NSAIDs. You can get a stomach ulcer, okay? When we go this pathway, when the LOX is stimulated and the leukotrienes are produced, leukotrienes create allergic reactions, inflammation. I think of bronchoconstriction of the airways and that wheezing and asthma type of effect. If we look here, we can see that we have this phospholipid membrane. We have phospholipase A2 that's going to pull out arachidonic acid, right? You naturally have arachidonic acid in the cell membrane wall. It just depends on how much arachidonic acid a person has. The more arachidonic acid you have, the more potential of inflammatory reactions you have. So the next question we should be asking ourselves is, how do we offset the amount of arachidonic acid? Well, that's through diet, and I'll show you that in a second. So now here are the two different pathways. We have lipoxygenase or cyclogenase. So if you want to downregulate the amount of leukotrienes produced, well, there are certain drugs that can block the LOX enzyme, or there are certain drugs that can block the COX enzyme, like NSAIDs or acetaminophen, or specific COX-2 inhibitors or aspirin, right? But when you get the COX pathway activated, you can produce prostacyclins that vasodilate and opens up the blood vessels, so lots of blood can get into that area. It also affects uterine tone. When the prostaglandin, the PGE2s, are stimulated, that also controls vascular tone. It can increase pain, it increases uterine tone, and increases temperature. That's why aspirin and ibuprofen and NSAIDs can ease a woman's uterine contractions that she's feeling during that menstruation, the time of the month. It can also decrease fever and decrease pain. When prostacyclins are stimulated, it can decrease uterine tone, whereas prostaglandins increase uterine tone. Thromboxanes are involved with clotting and also vasoconstriction. So aspirin can affect your platelets and thin your blood so that you don't clot. Okay, so we have the COX pathway, which is more pain and inflammation and fever, and then the LOX pathway, the leukotrienes, are more involved with neutrophils, chemotaxis, and bronchoconstriction. And everywhere you see these red lines are different places that you can manipulate artificially the pathway. So if you take corticosteroid, you can block this enzyme and this, right here and here. If you go further down the chain, that's where aspirin and NSAIDs are affected, and so on. Now, how do we affect this more naturally? How can we reduce the amount of arachidonic acid? Well, this is where we talk about omega-3s or fish oils, right, in the Mediterranean diet. So the omega-3s from flaxseed, walnuts, chia seeds, right, you get this linolenic acid. And then linolenic becomes stearidonic. It moves down to eicosapentaenoic acid, the EPA and DHAs. This is what you see in your fish oils. When you look at fish oils, some may be highly concentrated in EPA, some in DHA, depending on what you want to affect. You want to affect your blood vessels, your the cardiovascular system. You want to affect the eyes and the brain, right? Then you manipulate dosages of EPA to DHA. We want more brain and eyes, especially in young children. We want those DHAs high, okay? Look at the foods like fish and algae oil and salmon, sardines. This starts to look like the Mediterranean diet right here. So you don't see any arachidonic acid in this pathway. You can actually offset the amount of arachidonic acid in the cell membranes by consuming your omega-3. Now, the omega-6s, for the most part, in the standard American diet, SAD diet, SAD, standard American diet, tends to be pro-inflammatory because here's the arachidonic acid. Things like safflower, soybean, corn oils, your vegetable oils, really bad for inflammation. Your traditional meat, traditional eggs and poultry, very inflammatory. Now, if the animals are free range and grass fed, now you offset this because that's where you get a lot of omega-3s. So a lot of the studies are done with carnivore diets and traditional based diets, eating red meat, and chicken and dairy and eggs. These are pro-inflammatory animals because they're fed grains, right? Grains are inflammatory and you slice it and dice it. If the animal's pro-inflammatory and you're eating the byproduct of that animal, you're going to have an inflammatory reaction within inside of you as well. But if you eat the byproduct of an animal that is raised healthier with an anti-inflammatory diet with omega-3s, we don't see this as much. Okay, so hopefully this gives a really good understanding of the connection of inflammation. We do want inflammation. Acute inflammation is a true sign, the initial sign of healing. But chronic inflammation starts to degrade and break down a lot of proteins and collagen in the body. The body does produce proteases and collagenases, which can break down the body. Long term, no good. Short term, you sprain an ankle, you damage a ligament muscle. We want collagenases and proteinases to degrade the soft tissue. Short term, build up new, right? Catabolic, break away. Anabolic, build up. Break down, build up. Break down, build up. So inflammation needed. Acute inflammation, good. chronic inflammation, very detrimental to overall health. It is chronic inflammation that is probably the #1 killer and relates to every disease out there in America, for sure.